Jessica DeMassa, and I'm here at the HISA Studio at HIC 2017. I'm here with Glynda. Can you please introduce yourself?
Hi, I'm Glynda Summers, and I'm from Cairns, and been the Executive Director of Nursing and Midwifery in Cairns for the past 14 years.
Fantastic. And so I know you're very passionate about technology. You told me you built your own computer.
Yes.
When was it, 2000?
2000, yes.
Okay, so tell me a little bit about how you, in your role, had integrated technology in on the front lines with the nursing staff.
Yes. I've always been passionate about information and technology and how that can influence what the nurses can do in relation to assisting their clinical practice and their decision making, and also the managers especially. So I've implemented nursing acuity systems such as trend care in these areas, which have been a huge asset for the nursing staff in terms of determining the level of care, for example, that their patients require on an individual basis, as opposed to just estimating they'll need 4 hours per patient day. And I guess the important thing, and then I've also implemented clinical systems, electronic medical records at Cairns, as well as being an advisor, clinical advisor for the Queensland Health electronic medical record. But I think the key aspect of implementing any of these systems with the staff is actually involving them right from the start, to make sure that they, number one, know what's coming and are able to influence the end product, so that we know that they'll actually use it then, rather than it just sitting there and not being used.
That's typically one of the biggest challenges,
Yes,
right? And typically we hear too, it's like if it lives and dies with the nursing team on the front line.
Absolutely. And I think if the nurses embrace the technology, and that, I think they're the best teachers for the other clinicians in the clinical area too, because they're usually so passionate about it themselves, and they can teach, the other doctors and other allied health staff too about what they do in terms of the clinical systems.
What's your best advice for somebody who's working with a nursing population in terms of integrating that in? I know you had said to involve them. What does that look like? Can you tell me a little bit more?
Yes, that looks, usually have, number one, we've got to actually sow the seed first. So you generally just sow the seed and give them an idea of what's possible, and let them think about, this is the way I do it, and let them think about it for a little while, and then I actually show them what is possible with whatever systems are around, and then we get a user group or a reference group together and have them involved all the way through the development and the implementation plans, etc., for the systems, and also involve them. They'll be the trainers of the system themselves and super users and that. So it's involving them right from the time of sowing the seed right to implementing and then evaluating it at the end of the process.
Fantastic, that's good advice. And so switching gears just a little bit, I'm curious to know, as somebody who likes technology and who's been involved in implementing it for so long, what are you excited about in terms of the future of health technology right now here in Australia?
What I'm excited about is, I guess, the exponential growth in the possibilities that we're seeing now, and what it will all look like in the next 10, 15 years. I just, and after listening to the speaker this morning from the Institute at the Royal Brisbane, I think, wow, what are we going to be looking at in 10 years' time, and how that's going to influence the way we actually care for patients.
Yes, it's going to be fantastic.
Absolutely, yes.
Well, Glynda, thank you so much for joining us, and thank you for your time and your perspective. It was wonderful to have you. I'm Jessica DeMassa. I'm here at the HISA Studio at HIC 2017. Thanks so much.